Hello, everybody. This is your girl, Dr. Doris, and Happy New Year. Okay, guys, I'm just here to talk about the GP pathway. So, some people have been asking questions about the GP pathway, and I'm here today to give you some answers that you need to know. Okay, so now coming to work in Australia as a GP has become what a lot of people now crave to do. GP is no longer as it was before. Now it is more structured, it has a better framework, and there are younger people coming into the GP practice unlike before. So that would make you to see how relevant GPs are in Australia. As a matter of fact, the GPs are the primary care physicians. They take care of patients, mostly all of the patients need, and they decide when the patients are to be referred to emergency department or to go to other specialists. So that is the duty of a GP in Australia. So we basically treat everything. Okay, but when it is too tough or when we feel that the person would need an in-depth care, say depending on what is wrong with the patient, we'll move the patient over to go see the specialists. And there are lots of specialists in Australia. So we GPs work hand in hand with specialists for a better patient outcome. Now, if you want to work in Australia as a GP, there are a few things that you need to know because a lot of people do not consider these factors. But depending on your level of experience, say if you have a GP experience already, I have seen some GPs with many years experience that went through the GP pathway, and they did not need to do like stay a long time in the fellowship. Say you have up to 8 years working experience as a GP back in your home country, you can do what is called RACGP assessment. When they assess you, they can give you like 3 years or equivalent of 4 years working experience in Australia. And that is relevant for you because if you get absorbed by the college, then you can work as a GP. Probably, let's say they can tell you, okay, do more 6 months and then you become a fellow. You do the fellowship examination. If they feel that you're competent, they can just tell you, okay, now you can become a specialist GP. But that is all based on case by case basis. The decision is in the hands of the RACGP. Now, what you need to know, if you want to come in as a GP and you don't have much experience, say you have 1 to 2, 3 years experience, start with your AMC1. When you pass that, you do your English exam and you pass that, then you look for jobs. Start looking for GP jobs. And there's something you need to know about looking for GP jobs. When you don't have much experience, you don't need to look for GP jobs that are like saying VR, because a lot of people go in and be looking for VR. They won't give you. So you should focus on looking for DPA area and then non-VR, because if you haven't worked in Australia, you have higher chances of working first as a non-VR before you now become a VR, which is vocationally registered. So now you go from non-VR to VR. If you don't have much experience as a GP, when you get job as a GP, you need to pass your PESCI. So when you pass your PESCI, then you finish up your APRA registration, get registered, and then you start working depending on the level of supervision you are in. Then you can either decide to pass your AMC2 or do the PLAB route, do PLAB 1, PLAB 2, get GMC registration, then get your GenReg after 1 year. Now, when you get your GenReg, you can now proceed to fellowship. Now, there's something else that is being called pre-fellowship program. It's like something, an initiative that Australian government brought that actually helps GP to kind of get them ready for fellowship. And it provides some kind of funding for your professional development. So say before it was 20,000, but they recently reduced it to 15,000 yearly. So now if you go on your when you get your GenReg, you can then proceed to your fellowship. You write the fellowship exam. When you pass, then you can start your fellowship. You can either go through the RVTS that I've stated before, RACGP. You have the RACGP actually encompasses everything anyway. So you have the AGPT, you have the RVTS, which you can either do under RACGP or under ACRAM. Then you have the ACRAM fellowship. Okay, if you're doing any of these, once you finish, it takes you about 3 years. Then you can do the other sub-spec, that the rural generalist, that you can either focus on emergency medicine, radiology, pediatric, obs, and gynae. That's extra 2 years. Okay, so those are the things that you really need to know about GP. So first of all, PESCI is the rate limiting step to working as a GP in Australia, especially when you do not have much experience. So you would really need PESCI. Okay, now if you have a lot of experience working as a GP back home, you would just need to do your RACGP assessment and then pass your AMC1 and English, then PESCI. Then you start working, and it reduces the time you spend on the fellowship and the time it takes you to become a consultant in Australia, a consultant general practitioner. Okay, because GP is what we know as family medicine in other countries, because they encompass everything. And then you have your subspecialty, which is good. You can subspecialize in every other thing that you want to subspecialize in. So guys, I'll continue this video for the sake of time. I'll continue the explanation in another video. I hope you've enjoyed watching me. Please do give this video a thumbs up and love, and subscribe to my channel. Have a wonderful time. Bye.